Good afternoon. Good afternoon. I hate to disrupt your great socialization. You know, this is truly celebration. I'm so excited to see all of you. And, you know, to see all of you in person and being able to do this is just wonderful. So, in a few moments, you'll be formally inducted into National Academy of Medicine. And you officially join a very distinguished group of leaders in health medicine. You know, our members, like you, are leading the nation and globally on so many areas, health medicine. I'm so proud, and of course, we're so grateful for everything that you do. You know, just like this month, I showed earlier to our new members that one of our members just received Nobel Prize, and every year we have. So we have brought our total number of Nobel laureates in this academy up to 76. So now you know. And of course, 2 won the Lasker Award and many others. So now you know the bar set very high for all of you. I wish every one of you is going to get this so I can brag about what you've done. So to the members of class 2021, there are many people here who are so proud and are here to celebrate with you. And I just want to acknowledge the new members, friends, and family here tonight. Can you please stand? Doesn't it feel like commencement? But you know, your loved ones have supported you. And I think finally they say, oh, finally, not only they graduate, they got a job, now they're being recognized. They do something useful. So thank you very much. And I want to acknowledge also the nominators and sponsors of new programs who actually nominated many of you and who are here tonight. Can they also stand? Oh, okay. We thank them for their nomination, and they're here to celebrate with us. So it's wonderful. So it's my privilege to introduce each of the extraordinary members of the class of 2021 and to present them with a certificate of membership. What's exciting for me is that when I visit different members who are now Minister of Health in some countries and others, I walk in, I see a framed picture of their induction, which just gave me great pride. So each of our officers over here, and I'm going to introduce them. That's Carlos Durrell at the end, who's the International Secretary, Claire Brindis, the Vice Chair of our Council, Mike McGuinness, the Leonard Schaefer Executive Officer, Mike, and of course, Elena Fuentes-Affleck, who's the International Secretary. So they will assist me by reading names and a brief citation of accomplishment. Now, your accomplishment is so big that we need 4 people to do this. I didn't want to wear them out, so each one had a quarter of the work to do. Okay, so we have all of you sitting in the front of the auditorium alphabetical order, just like commencement. And we'll recognize all your members of class 2021, whether or not you're able to join us. So some will not be able to, but we recognize them anyway. And some members are watching online, ceremony online, and we welcome you and thank you for being here. And you can follow the ceremony order in the new member brochure that you receive before you enter the auditorium. So, okay, as you come on stage, I've already started fist bumping with you. I said to everyone, I'd love to shake your hands and to give you a hug, but if you were there's about 100 of you, and if you're the 99 to shake my hands, you know that you may not want to shake my hands. So, therefore, I'm still going to have this thing with me, but I think we're going to fist bump. Okay, so let's get started. And we're going to ask Elena to come up and start the first induction of members. Thank you.
Good afternoon. I am honored to begin the introduction of our newly elected members, beginning with Dr. Samuel Achilefu for his outstanding contributions in the field of optical imaging, which are used to identify sites of disease and non-invasive characterization of biologic phenomena. Congratulations and welcome. Dr. Achilefu is not able to attend today's celebration. Next, Dr. Alexandra K. Adams for her work partnering with indigenous communities in the Midwest and Montana and pioneering community-engaged research methods. Congratulations and welcome. Richard M. Adanu for spearheading the expansion of human resources and research capacity in Ghana and personally engaging in South-South research capacity building in sub-Saharan Africa. Congratulations and welcome. Michelle A. Albert for her pioneering research at the intersection of psychosocial stress, including discrimination, social inequities, and the biochemical markers of heart disease. Her unique interdisciplinary lens has illuminated root causes of cardiovascular disease and facilitated the identification of interventions to reduce the risk of cardiovascular disease among diverse racial ethnic groups and women. Congratulations and welcome. Guillermo A. Amir for his pioneering contributions to regenerative engineering and medicine through the development, dissemination, and translation of citrate-based biomaterials, a new class of biodegradable polymers which enabled the commercialization of innovative medical devices approved by the U.S. FDA for a variety of surgical procedures. Congratulations and welcome. Jamie D. Ard for the varied use of individually tailored, state-of-the-art approaches to treat obesity, which profoundly impact patients' health and well-being and reduce the burden of diseases associated with obesity, such as heart disease, diabetes, and hypertension. Congratulations and welcome. John M. Balbus for leadership in confronting the health challenges of climate change, from developing the first risk assessment approaches to working at the interface of science and U.S. national policy. Congratulations and welcome. Carolina Varillas Muri for discovering how Plasmodium parasites manipulate the mosquito's immune system in order to survive and how these interactions maintain malaria transmission around the world. Congratulations and welcome. Sherry Barkin for pioneering pragmatic, randomized controlled trials in community settings which were undertaken in collaboration with parents and community partners and addressing health disparities in pediatric obesity. Congratulations and welcome. Monica M. Bertognoli, for numerous leadership roles in multi-institutional cancer clinical research consortia and advancing the quality and scope of research to bring important new treatments to people with cancer. Congratulations and welcome. Luciana L. Borio, for her expertise on scientific and policy matters related to biodefense and public health emergencies. Congratulations and welcome. Eric Brote, for leadership in American Indian Alaska Native workforce development and pioneering innovative methods to identify, inspire, and support American Indian Alaska Native youth to excel. Congratulations and welcome. Dr. Broad is not able to attend our celebration. Kendall M. Campbell, for his work in assessing academic and community factors which impact the development of a diverse medical workforce to advance health equity, co-development of a Center for Underrepresented Minorities in Academic Medicine, and creation of a research group for underrepresented minorities in medicine, presenting and publishing his findings. Congratulations and welcome. Pablo A. Selnik, for work which has transformed our understanding of the physiologic mediators of human motor learning and the identification of actionable mechanisms for augmenting its acquisition and retention. Congratulations and welcome. David E. Clapham, for his paradigm-shifting discoveries in the field of ion channel signaling. Dr. Clapham is not able to attend, but we congratulate him and welcome him. Mandy K. Cohen, for creating a strategic alignment of Medicaid, public health, behavioral health, and human services during her tenure as North Carolina's Secretary of Health and Human Services, an alignment which was designed to bring about critical improvements in health. Congratulations and welcome. Hillary O. Critchley, for pioneering fundamental studies on endometrial physiology, including endocrine immune interactions, the role and regulation of local inflammatory mediators, and tissue injury and repair, which made major contributions to our understanding of the mechanisms which regulate the onset of menstruation and menstrual disorders. Congratulations and welcome. Daniel E. Dawes, for national leadership in health equity, and whose groundbreaking books, 150 Years of Obamacare and Political Determinants of Health, have reframed the conversation and led to actionable policy solutions. Dr. Dawes is participating by virtual format. We congratulate and welcome him. Ted M. Dawson, for pioneering and seminal work on how neurons degenerate in Parkinson's disease and providing insights into the development of disease-modifying treatments for Parkinson's disease and other neurologic disorders. Congratulations and welcome. Job Decker, for introducing the groundbreaking concept that matrices of genomic interactions can be used to determine chromosome conformation. Congratulations and welcome. Nancy Ann DeParle, for her leadership in the development and passage of the Affordable Care Act, her major role as administrator of the Centers for Medicare and Medicaid Services, and work on various NAM committees. Congratulations and welcome. Maximilian Dean, for developing and clinically translating novel diagnostic technologies for facilitating precision medicine techniques and for integrating advanced precision medicine into the area of liquid biopsies. Congratulations and welcome. Kafui Drasa, for seminal contributions to the neuroscience of emotion and mental illness, for pioneering methods for massively parallel neural recordings and analysis in mice, and for contributions to society through science policy and advocacy, a commitment to mentoring, and support for efforts to build a diverse and inclusive scientific workforce. Congratulations and welcome. Catherine A. Fitzgerald, for pioneering work on innate immune receptors, signaling pathways, and regulation of inflammatory gene expression. Congratulations and welcome. Yumen Feng, for transforming the fields of liver surgery, robotics in surgery, imaging and display in medicine, and gene therapy. Congratulations and welcome.
Howard Frumkin, for his work on health impacts from the environment, including those from climate change and other planetary processes, and on healthy pathways to sustainability. With an electronic fist bump, we offer congratulations and welcome. Andreas Garcia, for significant contributions to new biomaterial platforms that elicit targeted tissue repair, innovative technologies to exploit cell-adhesive interactions, and mechanistic insights into mechanobiology. Congratulations and welcome. Jennifer Gardy, for pioneering work as a big data scientist, harnessing innovation and communication to bring interdisciplinary problem solving and leading edge technologies to bear to elucidate infectious disease dynamics in the face of a changing climate, and for using the new domain of pathogen genomics to improve population health around the globe. Congratulations and welcome. Daryl Gaskin, for his work as a leading health economist and health services researcher who has advanced fundamental understanding for the role of place as a driver in racial and ethnic health disparities. Congratulations and welcome. Wandason Gabreas, for leadership in molecular epidemiology and global health and fundamental insight into how animal, agricultural, and environmental systems influence public health, community development, and livelihood worldwide. Congratulations and welcome. Tedros Ghebreyesus, for undertaking the major transformation of the World Health Organization, promoting primary health care and equity, effectively controlling Ebola outbreaks, and leading the global response to COVID-19. With an electric fist bump from Geneva, congratulations and welcome. Jessica M. Gill, for reporting, along with her team, that acute plasma tau predicts prolonged return to play after a sport-related concussion. Congratulations and welcome. Paul B. Ginsburg, for his leading role in shaping health policy by founding 3 influential organizations: the Physician Payment Review Commission, now MedPAC, the Center for Studying Health System Change, and the USC Brookings Schaefer Initiative for Health Policy. With an electronic fist bump, congratulations and welcome, Paul. Sharita H. Golden, for identifying biological and systems contributors to disparities in diabetes and its outcomes. Congratulations and welcome. Joseph P. Gaughan, for being a leading figure among Native Americans, mental health researchers, whose work on cultural psychology, historical trauma, indigenous healing, and contextual factors affecting mental health assessment and treatment has been highly influential and widely recognized. Again, with an electronic fist bump, congratulations and welcome. John D. Grabenstein, for establishing vaccination services by pharmacists across the U.S. by developing nationally adopted policy frameworks and curricula that trained more than 360,000 pharmacists as vaccinators, enabling rapid, widespread delivery of COVID-19 and other vaccines for advancing international vaccination and medical countermeasure programs, and for contributions to pharmacy national leadership development. Congratulations and welcome. Trish Greenhalgh, for major contributions to the study of innovation and knowledge translation in healthcare and work to raise the profile of qualitative social sciences. Again, with an electronic fist bump for Trish, congratulations and welcome. Linda G. Griffith, for long-standing leadership in research, education, and medical translation, for pioneering work in tissue engineering, biomaterials, and systems biology, including developing the first liver chip technology, inventing 3D biomaterials, printing and organotypic models for systems gynopathology, and for establishment of the MIT Biological Engineering Department. Congratulations and welcome. Tekjeep Ha, for co-inventing the single molecule SIMFRET technology and making numerous technological innovations which enabled powerful biological applications to DNA, RNA, and nucleic acid enzymes involved in genome maintenance. Congratulations and welcome. William C. Hahn, for fundamental contributions in the understanding of cancer initiation, maintenance, and progression. Congratulations and welcome. Helena Hansen, for leadership in the intersection of opioid addiction, race and ethnicity, social determinants of health, and social medicine, and for co-developing structural competency as clinical redress for institutional drivers of health inequalities. Congratulations and welcome. Mary Beth Hatton, for foundational developmental studies of cerebellum that have broad significance for understanding human brain disorders, including autism, medulloblastoma, and childhood epilepsy. Congratulations and welcome. Mary T. Hahn, for being a leading surgeon, educator, and health services researcher whose innovative work has built valid measurements for quality care, improved care standards, and changed surgical care guidelines. Congratulations and welcome. Zhigong He, for his breakthrough discoveries regarding the mechanisms of axon regeneration and functional repair following central nervous system injuries, providing foundational knowledge and molecular targets for developing restorative therapies to treat spinal cord injuries, stroke, glaucoma, and other neurodegenerative disorders. Congratulations and welcome. Edith Hurd, for contributions to the fields of epigenetics and chromosome and nuclear organization through her work on the process of X inactivation. An electronic fist bump for Edith. Congratulations and welcome. Hugh C. Hemmings, for being a pioneer in the neuropharmacology of general anesthetic mechanisms on neurotransmitter release, including effects on voltage-gated ion channels critical to producing unconsciousness, amnesia, and paralysis. Congratulations and welcome. Renee Henn, for discovering the role of neurogenesis in the mechanism of action of antidepressant medications and making seminal contributions to our understanding of serotonin receptors in health and disease. Congratulations and welcome. Helen Heslop, for pioneering work in complex biological therapies, leadership in clinical immunotherapy, and for being the first to employ donor and banked cytotoxic T cells to treat lethal virus-associated malignancies and infections in pivotal trials. Congratulations and welcome. Renee Shaw, for expertise in health disparities of emergency care, integrating the disciplines of economics, health policy, and clinical investigation. Congratulations and welcome. Lori Isom, for discovering sodium channel non-pore-forming beta subunits and leadership in understanding novel neurocardiac symptoms of sudden unexpected death in epilepsy. Congratulations and welcome. I'd like to invite Claire Brindis to the podium.
It's such an honor to be with all of you, and all of us are sitting there thinking about our own day. Katherine Jansen, for leading the teams that produced 3 revolutionary vaccines: Gardasil, targeting the human papillomavirus, Prevnar 13, targeting 13 strains of pneumococcus, and the Pfizer-BioNTech SARS-CoV-2 mRNA vaccine. Congratulations and welcome. And a hearty fist bite for her, because she's changed so much of our lives this year. Christine Johnson, for work as a pioneering investigator in global health, data science and technology, and interdisciplinary disease investigations, and in identifying and predicting impacts of environmental change on health and creating novel worldwide outbreak preparedness strategies and paradigm-shifting synergies for environmental stewardship to protect people, animals, and ecosystems. Congratulations and welcome. Mariana Kaplan, for seminal contributions that have significantly advanced the understanding of the pathogenic role of the innate immune system in systematic autoimmune diseases and immune-mediated vasculopathies. Congratulations and welcome, and she is attending here virtually. Elissa Konefa Gu, for leadership and innovation in ultrasound and other advanced imaging modalities and their application in the clinical management of significant healthcare problems such as cardiovascular diseases, neurodegenerative diseases, and cancer through licensing to the major imaging companies. Congratulations and welcome. Jay Lamory, for being a scholar, educator, and advocate on the effects of climate change on human health, with special focus on the impacts on vulnerable populations. Congratulations and welcome. Joan Luby, for elucidating the clinical characteristics and neural correlates of early childhood depression, a crucial public health concern. Congratulations and welcome. I guess a virtual fist bump. Kenneth Mendel for creating technological solutions to clinical and public health problems. Congratulations and welcome. Jennifer Manley for her pioneering work improving the detection of cognitive impairment among racially, culturally, and socioeconomically diverse adults that has had a profound impact on the field of neuropsychology, and her visionary research on the social, biological, and behavioral pathways between early childhood education and later life cognitive function. And Jennifer is with us also virtually, and we want to congratulate her and welcome. Elizabeth McNally for discovering genetic variants responsible for multiple distinct inherited cardiac and skeletal myopathic disorders and pioneering techniques for mapping modifiers of single-gene disorders by integrating genomic and transcriptomic data to define the pathways that mediate disease risk and progression. Congratulations and welcome. Nancy Messoyer for her efforts in tackling the COVID-19 pandemic and building a global preparedness and response system to prevent future pandemics. Welcome and congratulations. Matshidiso Moeti for leading WHO's work in Africa, including interruption of wild poliovirus transmission, advocating proactive action on climate change and health, and responding to COVID-19, Ebola, HIV, and other public health priorities, and for transforming the organization to be more effective, results-driven, and accountable. And she is joining us virtually. Congratulations and welcome. Michelle Monge for making groundbreaking discoveries on the intersection of neurodevelopment, neuroplasticity, and brain tumor biology, also joining us virtually. Congratulations and welcome. Vamsi Mutta for transforming the field of mitochondrial biology by creatively combining modern genomics with classical bioengineerics. Congratulations and welcome. Leonard Mucke for his leading role in defining molecular and pathophysiological mechanisms by which Alzheimer's disease causes synaptic failure, neural network dysfunctions, and cognitive decline. Welcome and congratulations. Vivek Murthy for being the first person to be nominated twice as Surgeon General of the U.S. and leading the national response to some of our greatest public health challenges, including the Ebola and Zika viruses, the opioid crisis, an epidemic of stress and loneliness, and now the COVID-19 pandemic. Welcome and congratulations. Jane Newberger for her world-renowned work as a pediatric acquired and congenital heart diseases, research and translation into practice. Welcome and congratulations. Keith Norris for making substantive, intellectual, scientific, and policy contributions to the area of chronic kidney disease and health disparities in under-resourced minority communities, developing transformative methods for community-partnered research, and developing and implementing innovative programs that have successfully increased diversity in the biomedical health workforce. Welcome and congratulations. Marcela Nunez-Smith for notable contributions in health equity that have been distinguished nationally, including being named chair of the Governor's Reopen Connecticut Advisory Group Community Committee, co-chair of President Biden's Transitional COVID-19 Advisory Board, and chair of the U.S. COVID-19 Health Equity Task Force. And she is joining us also virtually, so we welcome and congratulate you. Osage Obasogi for bringing multidisciplinary insights to understanding race and medicine and climatic disruptions that threaten health inequities. Welcome and congratulations. Wando Olan Iwala for innovation in health equity, primary care and health systems transformation, health information technology, and workforce diversity, being the architect of many profound delivery innovations for underserved communities and leadership efforts in making the U.S. and other health systems more efficient, effective, and equitable. Welcome and congratulations. Bruce Oviagele for leading several pioneering National Institutes of Health funded research programs addressing the burden of stroke in vulnerable populations, racial and ethnic minorities, the socioeconomically disadvantaged, the uninsured, and rural dwellers, both in the U.S. and in Africa, as well as creating transformative NIH-supported training initiatives in both regions targeting individuals who are underrepresented in medicine and science. We welcome and congratulate you. Drew Pardal for discovering 2 immune cell types and leadership in cancer immunotherapy, which has revolutionized oncology. Welcome and congratulations. Guillermo Prado for his scholarship in prevention science and for his effective youth and family-focused HIV and substance use prevention interventions, which have been scaled throughout school systems and clinical settings in the U.S. and Latin America. Welcome and congratulations. Carla Pugh for pioneering sensor technology research that helped to define, characterize, and inspire new and innovative performance metrics and data analysis strategies for the emerging field of digital healthcare. Welcome and congratulations. Charles Rice for helping to identify the hepatitis C virus proteins required for viral replication and developing culture systems that enable the discovery of direct-acting antiviral drugs that can cure virtually all infected patients who would otherwise risk premature death from liver failure and cancer. We congratulate and welcome him virtually. And now I'd like to welcome Carlos Del Rio.
Thank you, Claire. Marilyn Ritchie, for paradigm-changing research demonstrating the utility of electronic health records for identifying clinical diseases or phenotypes that can be integrated with genomic data for biobanks for genetic medicine discovery and implementation science. Congratulations and welcome. John Arne Rottingen, for advancing the conceptual underpinnings of incentivizing innovations to meet major public health needs and secure widespread access. John is not here today, so a big, internet fist bump. Congratulations and welcome. Yvette Rubido, for pioneering the translation of evidence-based interventions to reduce incident diabetes and related cardiovascular complications among tens of thousands of American Indians and Alaskan Natives. Congratulations and welcome. Eric Rubin, for pioneering bacterial genetic tools being used to create the next generation of anti-tuberculosis drugs. Congratulations and welcome. Renee Salas, for rapidly advancing the medical community's understanding of the nexus of climate change, health, and healthcare through highly influential and transformative work, such as that written in the Lancet Countdown on Health and Climate Change and the New England Journal of Medicine. Congratulations and welcome. Thomas Sequist, for expertise in Native American health, quality of care, and healthcare equity. Congratulations and welcome. This, unfortunately not attending, but virtually. Kozali Simon, for her scholarly insights on how economics and social factors interact with government regulations to affect healthcare delivery and population health. Congratulations and welcome. Melissa Simon, for paradigm-shifting implementation research that has elevated the science of healthcare disparities and has transformed women in health practice, policy, and outcomes. Congratulations and welcome. Anil Saad, for discovering the mechanistic basis of chronic stress on cancer and the pivotal role of tumor IL-6 in causing paraneoplastic thrombocytosis, developing the first RNAi therapeutics and translating multiple new drugs from lab to clinic, and devising and implementing a paradigm-shifting surgical algorithm for advancing ovarian cancer, dramatically increasing complete resection rates. Congratulations and welcome. Samba So, for groundbreaking vaccine field studies, paving the way for implementing life-saving vaccines into Mali expanded program of immunizations, pioneering studies of disease burden and etiology of diarrheal illness and pneumonia, major cause of pediatric mortality in Africa, and leadership and control of emerging infections such as Ebola and COVID-19 in Mali and West Africa. Dr. So is attending virtually. Congratulations and welcome. Raisa Sperling, for pioneering clinical research that revolutionized the concept of preclinical Alzheimer's disease. Congratulations and welcome. Sarah Santon, for pioneering new approaches to reduce health disparities among low-income older adults. Congratulations and welcome. Sarah Tishkoff, for being a pioneer in African evolutionary genomics and research. Congratulations and welcome. Peter Tontonos, for being a pioneer in molecular lipid metabolism, defining basic physiology, and revealing connections to human disease. Dr. Tontonos is attending virtually. Congratulations and welcome. Joanne Trejo, for her discoveries of how cellular responses are regulated by G protein-coupled receptors in the context of vascular inflammation and cancer. Congratulations and welcome. Gustavo Turecki, for work in elucidating mechanisms whereby early life adversity increases lifetime suicide risk. Dr. Turecki is attending virtually. Congratulations and welcome. Gilbert Upchurch, for making seminal contributions to the understanding of the pathogenesis of vascular disease and contributing greatly to the advancement of all aspects of vascular and surgical care. Congratulations and welcome. Tanner Vinema, for her career-long dedication to advancing the science of climate change and health, particularly in the areas of disaster nursing. Congratulations and welcome. Leslie Vosshall, for building the yellow fever mosquito Aedes aegypti into a genetic model organism for neurobiology and uncovering major insights into how this disease vectors insects select and feed in the blood of human hosts. Dr. Vosshall is attending virtually. Congratulations and welcome. Rochelle Walensky, for her work that motivated changes in HIV and COVID-19 guidelines, influenced public health practice, and provided rigorous evidence for decisions by the U.S. Congress, the World Health Organization, and the Joint United Nations Program on HIV/AIDS. Congratulations and welcome. Elizabeth Winsler, for pioneering work on antimalarial drug development. Congratulations and welcome. Cynthia Wahlberger, for pioneering structural studies elucidating molecular mechanisms underlying combinational regulation of transcriptional ubiquitin signaling and epigenetic histone modification, which has provided a foundation for drug discovery. Congratulations and welcome. Anita Sadi, for global leadership in pediatric infectious disease research and capacity development relevant to improving newborn and child survival in developing countries. Congratulations and welcome. Shannon Senk, for research on the built environment in racial, ethnic minority, and low-income neighborhoods that enrich understanding of the factors that influence health and contribute to health disparities, demonstrating the need for multi-level approaches to improve health and achieve health equity. Congratulations and welcome. Fan Sang, for revolutionizing molecular biology, empowering transformative leap forward in our ability to study and treat human diseases through the discovery of novel microbial enzymes and systems that their development as molecular technologies, such as the optogenetics and CRISPR-mediated genome editing, and for outstanding mentoring and professional services. Dr. Zhang is not here with us, is attending virtually. Congratulations and welcome. This concludes the induction of all class of 2021 members. I want to ask now a round of applause for all new members. Welcome to the National Academy.
Let's do it again. Oh, wow, great. Wow. Isn't that great? I think that you brought your cheerleaders to this meeting today, but you have every reason to be cheer-led, and thank you very much, so much indeed. So this does mark the end of the induction ceremony, although we're not done yet. We're going to have dinner together, but before we do that, I'd like to make sure that tomorrow we have the pleasure of welcoming your peers, class of 2019 and 2020. So they did not have the induction the last 2 years for obvious reasons. So we actually go through that tomorrow once again, or twice again. So just so that those family members who's here like to attend, because I already went through with the members, on Sunday we begin early with the interest group. And if you look at your programs, you get to choose where you want to go, and the topic would be just terrific, all important issues that relate to health and medicine. And then for members, we have a business meeting in the morning around 10:30, I believe, 10:45, an awards presentation after that. And then Sunday night, wait a minute, that's Sunday. Tomorrow is the induction. Sunday night is the gala. I hope many of you will be there, because we're going to celebrate our 50 years. On Monday, I'm going to introduce all of you the new members to the members at large. So I think our members will be so excited meeting all of you, and I look forward to seeing you there. We have a great lineup of a program about the future of biomedical research. So, almost time for dinner. Our dinner will be served in the tent. For those who just came in, you see the tent, I guess, facing the building on the left. If you go this way, you turn to the right. And so exit the auditorium, turn right, and staff would direct you further. And please pick up the ticket on the table, which will be collected by a server. And I guess you'll get to know which table you're sitting at. And following dinner, for those who are staying at the Grand Hyatt or State Plaza hotels, shuttle buses will be available after dinner on the 21st Street. And please let the driver know if you're staying at either one or the other hotel. Okay, we're done. Let's celebrate. We'll see you at dinner.